Good morning, everyone, and welcome to week 2. And I'm really excited to have our friends here, Cindy, wave Cindy, so they know that's Cindy, and Christina Harden Weiss. And they sent me some information this morning I want to share with everyone. They said their goal is to be a trusted resource for individuals looking for information regarding adaptive equipment and how to use it safely to enhance seniors' ability to age in place. And I think that's awesome. Cindy graduated in 1992 with her master's degree of physical therapy from Washington U in St. Louis. I put a nice R in that, Washington U. Did you notice? Wash U. The majority of her career has been spent in home health with short stints in skilled rehab and outpatient therapy clinic sessions. Her passion is assisting people in maintaining their independence, especially when it makes a difference in their ability to remain in their home. Christina is a graduate from Eastern Illinois University with a master's degree in speech language. She has spent most of her career treating patients in the skilled nursing facility. She most enjoys working with people that have difficulty eating, chewing, and swallowing after illness or disease. We welcome both of you. And as Chris mentioned, they will take questions at the end. However, they said if there's questions that pop in the middle, they will definitely try to get them answered. Christina and Cindy, thank you so much for joining us, and we're looking forward to your presentation.
Great.
Thank you.
Thank you for having us. Let me get my screen share going here. Hang on one second. Oops. Let's get our screen share going first. Okay. Oops.
All right. Very good. So we want to welcome everybody. We appreciate everybody being here today. Again, my name's Cindy, physical therapist, and I have been practicing for about 27 years, mainly with the geriatric population in the home health setting.
Yeah, and I'm Christina. I'm the speech language pathologist. I've been practicing speech therapy for about 20 years, and my area of focus was mostly with geriatrics in long-term care.
Mm-hmm. And we work for, our business is Adaptive Equipment and Caregiving Corner. Mm-hmm. So like Chris had mentioned, we are an online educational and instructional resource. So today we are talking about preparing clients for a successful return home. So what are we talking about with this? We are talking about when our clients or our loved ones are leaving a healthcare facility, whether it be a hospital, a skilled nursing facility. We want to focus on that transition home. So being in home health, I deal with this. I've dealt with this for many years. I hear lots of stories. And a lot of times this transition is not so good. And when people have trouble or have an increase in pain or have problems with this transition, they're always upset with somebody. And usually it's the facility they left. So we want to try, besides helping out the facilities, we want to try to help that transition be better, have everybody be happy, be safe when they return home. And with that, we want to educate on home safety and fall prevention, because that's where the biggest issues arise when they make that transition home. So what I want to talk about is falls, first of all. So some not so fun facts about falls. According to the CDC, falls are the leading cause of fatal and non-fatal injuries among our older adults. And for statistics in 2018, there were 36 million falls, resulting in 8 million injuries from those falls. And they are predicting by 2030 that we will be up to 52 million falls, and that is a year, and 12 million injuries from those falls. Now, the CDC website, I just want to throw that out there a minute. Excellent website. It's got some information on STEADY, which is Stopping Elderly Accidents and Injuries, all kinds of information on false statistics, fall prevention, things like that. So very good website. Besides that, I happen to be a numbers nerd. So they also have this nice little thing on there. It's called Whiskers, and it stands for Web-Based Injury Statistic Query and Reporting System. So it's a very nice system that you can go in. You can add different fields like diagnoses, age, that type of thing, and find out different statistics for hospital readmissions and things like that. So I just thought I'd throw that out there. It's a really cool reporting system. So I took a look at a study that was done by the University of Michigan in 2018, and they were actually taking a retrospective look at U.S. hospital discharges among 8.3 million Medicare beneficiaries from age 65 and older. So that information was taken from January 1st, 2013 through November 30th, 2014. But the study was actually, the look back was actually during 2018. So in that study, they found that fall-related injuries ranked a third leading cause of readmission, that 30-day readmission. So that the fall-related injuries was the third leading cause for that 30-day readmission rate. Of those in the group with a fall-related or cognitive impairment on admission to the hospital, the fall-related injuries were a second leading diagnosis for readmission. And then with that, the patients that had the fall-related injuries on admission to the hospital and they were discharged to home or to home health, the fall-related injuries were the primary leading readmission diagnosis on that 30-day readmission rate, which is very concerning to me as a home health physical therapist. There's not more recent, or I couldn't find a more recent study that focused on the 30-day readmission rate with falls. But if these statistics hold true as we continue to increase falls, and by the predictions of the CDC by 2030, this readmission rate is going to continue to grow as in related to falls. So some of my concerns here are, are we discharging people too early, number one? Number two, are we really attending to them as being a high fall risk when they're in our medical facilities? So yes, I see people all the time come home with the high fall risk bands on, which they were tagged in the hospital or the skilled nursing facility as a high fall risk. But are we really focusing on education for them prior to returning home? And then lastly, is there a delay in service? Even if there's a 2 or 3 day delay, which actually right now in this area and in most of the service, home health services right now, we have a delay of a week to 2 weeks on starting people for home health. So, those are some questions that I have in my mind. So that makes me want to focus on what can we do? What can we do? So at Adaptive Equipment and Caregiving Corner, our focus is to promote preparation and prevention. If I could stand at the tallest hill or the highest mountain that I can find and yell this at the top of my lungs, I certainly would. Our healthcare system has not always been known for prevention. We're more of a reactive type of system. I think some of the plans we're realizing very slowly that we need to be more preventive, but we're not there yet. So that's part of our mission, is to try to promote more prevention in our healthcare. So one of the things I want to point out is, these caregivers, they are trying their best to bring their loved ones home. And there's nothing worse for them to get their loved one home and realize, oh my gosh, I am not ready. I am not ready to have them here. So we want to focus on 2 areas today. When we talk about hospital stays, we either have a planned hospital stay, such as an elective surgery, or we have an unplanned hospital stay. And these are the areas that we want to focus on what we can do to help with this fall rates, as well as these improved transitions home. So with the unplanned hospital stays, in your packet that you will be receiving, we have what we call our quick start guide. So what we're trying to do is we're trying to focus on 3 of the top, because there's not a lot of time, and with an unplanned hospital stay especially, a lot of information coming at the individual patient and the caregivers in a very short period of time. So what we want to do is, if they can focus on nothing else, let's take a look at these top 3 areas. After, of course, we want to make sure while they're there, they want to address things with the therapist on how they're going to safely get their loved one in the house. But then we want to take a look at these top 3 areas. So we're going to be talking about the comfy chair, the toilet height, and the bed height. So let's take a look at the comfy chair first. So we all have our favorite place to sit at home. You know, we've got a recliner, we've got a couch, something like that. Inevitably, when people come home from a hospital stay or from a skilled nursing stay, their comfy chair or seat is typically too low. It's difficult for them to get up because of weakness, maybe because of pain. So we want to focus on this and try to get them to see if they can make some corrections before bringing their patient home or their loved one home. So command central next to the comfy chair. We want to make sure we have a nice place for, and an easy accessible place for their drink, a phone, the light, the remote control, those types of things that they can get to and easily access. The next thing that we want to take a look at also is the height of the chair or the couch that they're sitting on. Typically, if we can get those things raised a couple of inches, I like about 4 inches. That seems to be a pretty good range right there. But I will talk about this type of thing. This is a platform riser. This is, I built that myself. It's made of 2x4s and a piece of plywood. On some of the videos that you'll be seeing later, I go through, you know, what type of material I use for this. Something like this, furniture risers. Sometimes I have people use cinder blocks. Depends on what the base of the couch or the chair looks like. So that is something that we want to do to raise that seated surface up a little bit to make it a little bit easier. We also want to make sure that where they're sitting preferably has some arm push off, somewhere to put their hands to push off from. Okay. Now, if a person has a rocker recliner, this I found has been very helpful. You know, when you scoot forward in a rocker recliner, the seat, because it rocks, will drop an additional 2 to 3 inches. So if we can prevent that rocking from happening, it will at least give them 2 to 3 inches to help them get up. So in this case, what I do is I'll take a couple of books, I'll take a couple of blocks of wood, or this is a handheld weight, and I'll put it right underneath the front edges of the chair. Now, not under the base, but under the front edges of the chair. I usually tip the chair back just a little bit and put those under there, and it prevents the chair from rocking forward. And again, it makes it more stable and it is helpful in getting up. I had a client that came home, hip surgery, very, very nervous client anyhow, which I felt bad for him. But he got home and he could not sit in his nice leather rocker recliner chair. He did sit in it, let me take that back. But whenever I got there, him and his wife were beside themselves because they couldn't get him out of it. We talked about, you know, a lift. And in the meantime, I asked him if he had some pieces of anything, wood or books or blocks. And we went out to his garage, got a couple of pieces of wood, stuck those under the front of his chair. And he was immediately able to get up and out of that on his own, just pushing up from the handles. He was so happy. And if I had $1 for every time somebody said to me, I wish we would have known this stuff ahead of time. You know, and that's where we can all come in, whether you're a caregiver, whether you're the individual going into, you know, the hospital, or you have an elective surgery or something. These are things to take a look at to make those things easier. Okay. So the next thing we want to take a look at is toilet height. Now, if we get our loved one home and they are not feeling well, they're weak, they're in pain, the toilet is going to feel this tall. I've also had situations, in fact, that same gentleman had difficulty with the toilet. He had difficulty with all 3 of these areas that we're going to talk about today. But toilet height is a huge thing. A lot of people think, oh, this is going to be a piece of cake. There's no problem there, but there typically is a problem. The other thing is if there's no hand push-offs, that is a big problem. So if you think about it, if you've had surgery on a leg, a hip, a knee, something like that, if you have a standard size toilet, which is usually 15 to 16 inches off the floor, that is going to be hard to get off of. You may not be able to get off of it. Okay, so some of the recommendations that we make for toilets. This is something that I prefer. This is actually a bolted toilet riser, and it has handles. I like this in particular because it actually goes under the existing toilet seat. One thing that you need to watch with the risers with handles is the width between the handles. Now, these handles adjust into 2 different widths, I believe, but we want to make sure that that looks okay as far as when we look at those. If you, and again, toilet paper holders, towel racks, those types of things, pedestal sinks, those are not good push-offs. We should not be leaning full weight on those things to help us get up off the toilet, okay? Now, if you have a client or a loved one that is very weak and actually cannot physically get to the bathroom, then you might want to take a look at a bedside commode. Now, with a bedside commode, it is not always covered by insurance. To get it covered by insurance, you have to be what they consider room bound, which means maybe you have a bathroom that's on a second floor of your home that you can't get to. Maybe you are so weak that you physically can't leave a room. So that has to take, a letter from the doctor saying, yes, you are room bound to get that covered typically. Now, the other suggestion is, and of course with all equipment, always check your local lending closets. Now, we have a great lending closet here, St. John's Community Care, of course. We also have St. Louis Help. So these are lending closets. I would check those out first and foremost. One other thing that I want to say is with a bedside commode, always know that, once the individual gets a little bit stronger, that bedside commode frame can then be taken and put over the toilet. Again, you got to kind of check the specs as far as the measurements, but usually those frames will sit right over the toilet, and then you have a hand push off as well as an adjustable height there. As far as equipment in the bathroom, I just want to give out a reminder here. When you order equipment in the bathroom, most typically that it is not returnable if the packaging has been taken off because it's a hygiene issue. So you want to make sure you're looking at specifications, you want to take measurements, things like that. And that's why we're promoting trying to be prepared ahead of time before our individual comes home. So the next area we're going to take a look at is the bed height. Now, we all know our beds now are extremely tall. A bed can feel actually this high, I'm sure, when someone comes home and they're weak or they're in pain. And it's difficult to get it in and out of. Now, not everybody stays in the bed the first couple nights. Some people do. Some people want to get in that bed and they get frustrated when they can't. Some people may use their rocker recliner, but by golly, if they can't get out of it, they're in trouble. So again, these are some of the areas that we look at. With the bed height, most often I want to try first and foremost to bring the bed down to my individual or my patient. Now, I have noticed over the years, just bringing the bed and the frame off of the bed and the box spring off of the frame down to the floor height is typically a little bit too low for most people, unless you have an individual that's fairly short. So I had a client whose sons did this, the picture here on the right. They took 4x4 deck posts and just put it under the box spring, which made it a perfect height for her to get on and off. So that's a good solution. If you cannot bring the bed down, if the legs don't adjust or you can't do something like this, then next step is to bring the person up to the bed. Now, sometimes I walk into homes and I have people using these itty bitty step stools that are about 8 inches high and they're about this big around and you can barely get 1 foot on it. Absolutely not. I do not like those at all. I like something that's going to be wide and secure. This step that's in this picture is an aerobic platform, something that's very easy to pick up at Walmart or get on Amazon. They usually have a couple of levels of risers to adjust that platform. And then in a situation like this, I would typically add a bed rail. It just makes for a very good handhold when the person is standing up on that step ready to sit down. Now, in this situation, if you have someone on a walker, which is pretty common when they leave a healthcare facility, you want to make sure that there's room between the wall and the footstool, the step up, to get through. And usually what I'll do is have the person turn around, back up to the step, and then they'll have the walker for both hands. They can push up from the walker. They will step up onto this step stool. They'll do this just like they do a regular step. You're coming up first with the good foot. So you have them step up to that while they have support with both hands on the walker. Once they're on the step, they can take a hold of the bed rail and have a seat on the bed. Next to the bed as well, I want to point out, you always want to have a light that is well within reach. So you want a light, you want to have a place for their phone, a place for their drink, a place for the TV remote control. Over the years, I have had numerous people that have had an issue with, they've put their light a little bit too far out of their reach, so they have to roll toward it to get to it, and they roll right off the bed and onto the floor. Now, in this circumstance, the bed rail would help with that, of course, but we certainly want that light well within reach so that they can turn it on and see what they're doing. The other thing that I suggest in the bedroom is motion sensor lights. I like that path from the bed to the bathroom very well lit. So motion sensor light in the bathroom, and if the path is fairly long, maybe a couple throughout the path. The other thing that I will usually recommend is a motion sensor light that's put under the bed. We usually work with one, it's a little one, it's a freestanding one, it's called Mr. Beams. It's battery operated. You don't have to have it plugged in anywhere. And I'll set it under a client's bed so that it's not on their nightstand. If they're rolling back and forth, it keeps going off. But if you put it under the bed, as soon as they bring their feet down, the motion from their feet will light the path right there at the edge of the bed. So we usually recommend that as well. All right, so where to start with a planned hospital stay? Here is where we can really make an impact as well. We want to either, again, as a caregiver, as a social worker, as a nurse, healthcare provider, anybody that has our contacts with our clients, whether it's at a pre-op or anything like that, we want to prepare them by having them assess their home. So in your packet, you're going to have a home safety checkoff list. Now you can find many of these over the internet. The thing with this one in particular, the one that we've developed, is in the subscription, you actually can use this as an interactive document, and Christina's going to show that in just a little bit, but you'll have access to this as an interactive document to then go back and try to check out videos and different pieces of equipment to help solve these areas of concern. So what we like to do is get this to our client ahead of time, have them go check their homes, check off areas of concern, and if we have a chance, have them bring it back to us or have them, get in touch with us if there are things that they can't correct. So if there are, let's help them correct those before they bring their loved one home. So that's a home safety checkoff list. We also have access on our website and in the subscription to an equipment index. So what we've done is we have labeled the equipment to match up with the checkoff list. So we have the checkoff list that's in different zones of the home. And then we have the equipment here that matches that checkoff list. And these are just suggestions on how to remedy what some of the concerns are in the house. Now, all of these pieces of equipment, this is an Amazon link. Full disclosure, we are an Amazon affiliate, but what that means is if someone purchased something, we get fractions of a penny on $1. So the big thing with the Amazon, and the reason we did that is because Amazon is very well known, and at least it gives a person a starting point. So if you click on the grab bar from Amazon, you're going to get that grab bar, you're going to have the specs, but you're also going to have probably 5 or 6 other grab bars, different sizes and shapes right there to check out as well. So that's what we've done with the equipment index. And we want to try to get people to take a look at this and get that stuff ready to go. Get it before their loved one comes home and have it ready and set up before they even get home. The other thing that we will include in the packet, that's included in the packet, is just some questions that come up frequently that I would prefer my people have answered before they get home, just so that they're in the know. So some of the things that I like to have them do is, make sure you know whether or not your loved one needs somebody to stay with them. If this is somebody that stays by themselves, typically, are we recommending that they have somebody there? Typically we are, and for how long? And if so, does that person need assistance when they are up with their walker or up on their own, or do they not? If they need assistance, can we have a gait belt? Can you send a gait belt home with us so that we make sure that we're being safe when we're assisting them when they're up and around? One thing I like for people to know, does my loved one have any restrictions? If they've had some type of a cardiac surgery, a hip or knee surgery, there may be restrictions on lifting. There may be restrictions on different precautions that they have to follow. So let's make sure that we have the restrictions, and preferably written down on a piece of paper. We also, again, want to make sure that we've talked to therapy about how we are going to get our loved one in and out of the house. Now, one thing to tell your caregivers is therapists will ask, okay, where do you think would be best for them to come into the house? How many steps are there? Do you have a grab bar or a rail? And it's funny because it's not funny, but it's a lot of times when you're asked those questions and it's kind of a rush situation, you may not remember because you go up and down your steps and all the time. So you may not know or remember what the situation is for your loved one coming home. The other thing that I deal with quite a bit, and I don't know what the happy medium or the solution to this is, but I do certainly want to point it out, is a lot of times, especially when there's been a surgery, that first night transition home is made terrible because of pain. A lot of times people will get their discharge okay from the doctor, maybe early to mid-morning, and then by the time paperwork gets done, they may get discharged, afternoon or later than that. It always seems like the pain medication schedule is not quite to the point that it takes care of that client enough to where they can get packed up, get in the car, get home, or get run by the pharmacy to get, the pain medicine, and then get home and then have a comfortable first night. It typically seems like the pain is getting ahead of the clients. They've been too long without pain medicine. I've had clients that actually have gone home so late that their pharmacy's not open. So that situation, I try to encourage my people, and, it just kind of depends on the situation, but I encourage my people to say, hey, before I get discharged, can we please make sure that we have the medication dosage the best we can so that I am getting a pain pill right before I leave, just to help that transition. But that seems to be one of the biggest complaints, especially with surgical clients, for the first night home. The other thing I recommend is if your loved one already has a walker and it's in good shape, let the hospital know that. If they've gotten one, of course, within the last 5 years, they won't be able to get another one issued. But if they have something that's in good shape, let them know. Ask them if you need to bring that up to the hospital so that they don't necessarily get issued a walker if they don't need one. The other thing is has your loved one been started on any exercises? If they have, we want a picture of those. A lot of times, caregivers are so good about getting their loved one home, making sure they're comfortable, getting them all set up, but they want them to stay put. And I totally understand that. But that's where we need the communication, because if we have our person stay put too long, that is going to continue to add to their weakness and their lack of function. So we want to know, how are they mobilizing? Have they had any exercises? Do I need to assist them so that I can actually get them up and help them start moving around a little bit, as long as it's safe? You know, we want to do what we can to keep them mobile and keep them functioning. And last but not least, if the person has had a total hip replacement, please make sure that they're sending you home with written hip precautions, because there's typically always some type of precaution with a hip replacement, and it depends on the surgical procedure as to what precautions they're going to be following. So you want to know that. You want to actually have those written out so that you make sure that you're following those. So those are a few questions. So, you know, like I said, our big focus at Adaptive Equipment Caregiving Corner is, you know, prevention and trying to be proactive, whether it's keeping the caregiver safe, whether it's keeping the loved ones safe, trying to really educate people, because there's so many caregivers out there. There's a lot of caregivers that don't know they're caregivers.
Mm-hmm.
And there's a lot of instances that you become a caregiver overnight. So we want to raise people's awareness that this resource is here, and that's what we want to be. We're here to help. We're here to provide as much information as we can to make those transitions, make caregiving in general as easy as it can be. But we all know it's not easy, but we want to try to lighten that load the best that we can. So we're going to have Christina actually take you to our website here, our dashboard. Now, we're going to go through the home safety checklist, a couple of things, just kind of show you what's available here for you as a resource.
Yeah. All right. So having said all that, I just want to kind of show you a couple of the platforms. So we're talking about planned versus unplanned admissions to the hospital. So we work with AgeSmart, and they have access to all of our videos, to our video library for the Caregiver series, as well as for the Home Safety Toolkit. So reach out to them. They have access. They have an access code that they will be able to give to you. So please reach out to them. We'd love for you guys to have access to these videos to help your loved ones or your clients. So we'll start with the planned first. So we've got, you'll start out here. So you'll come to our website, which is aecorner.com. If you type that in, it'll drop you off here. If you have that code, when you get that code, you'll come here, you'll click on the register button. The register button will take you and drop you off to a page where you'll have to sign in with your name. You'll have to put your email address, and then you'll have to create a passcode. You'll put in the access code that you can get from AgeSmart, and then you click sign up, and then it drops you off on your dashboard. So now you have your dashboard here. You'll see up here in the series, when you click on series, what that will do is you guys will have access to the Caregiver and to the Home Safety Toolkit. Here's some of the other series that we have in our library. So we're going to start with the Home Safety Toolkit. And what this does, we were talking about that earlier. And so this will be for the people with a planned hospital stay. You guys can have access to this. Click on the Home Safety Toolkit. And then you can see so what we've done is we divided the home up into 7 areas. And then this corresponds with the PDFs that we've created. So with a home safety checkoff list, as well as the home equipment index. Okay. So when you click on, so this is the very first, the introduction. And then right here, every video we have has a comment section. So we know that sometimes people prefer to read things. So we try to encourage that and we've put everything that's really important in the video in a narrative form down here under the comment section. On the introduction, though, we have the downloadable resources right here. So not only can you get them on our website, but you can also get them off of here. So here's the home safety checklist. You click on that, and it will take you to here. Now you can print this off and give it to your client or to your caregiver. They can walk through the house. They can, with the print off, checking the areas of concern, have them bring that back to you, and then you guys get back on the computer, and then you can interact with the PDF from here. So if somebody has a difficulty or they have an area of concern with the edges of their steps being clearly visible, they could check, they might have check marked yes, that's true. They could come here and click on the video, and it will take them directly to that video on how to fix the situation. And if they want to, if they're interested in finding out more about that piece of equipment or that supply, they could click here and it will take them directly to the equipment index and they can take a look at it on Amazon. So going back to our home safety toolkit here. So then you could go down, so you click on whatever area that you're concerned with or that you would like to take a look at. So here's home entrance. We've got living room, the kitchen, the stairway within the home, the bedroom, the bathroom, and then we have some general safety tips here. So what you'll do is you go to that particular area. You would click on, let's say we're going to click on this safety tips for the home. Then here's the video. You would click to start the video. And we're just going to show
Cindy here, physical therapist with a quick tip on stairs.
So again, here's the comment section. And then there's also, if we have downloadable resources or additional resources, this is where you would find those. Yeah, we could show real quick.
Whether they're inside or outside, you always want them to be clutter-free. You want to make sure that both the steps and the rails are in good working condition. You would like to have at least one rail or grab bar for improved safety. You want to check the surface. You don't want it to be slick. So I've added some non-skid tape here. I've also added some green tape just so that each edge of the step can be clearly visible. So let's take a look at the grab bar situation. So here's an example of a grab bar, and just so that the grab bar is not lost in the background color, I've added some pink tape for those that might have some trouble with vision. So those are a few safety tips on stairs.
So as you can see, we try to make our videos, we try to keep them short, we try to keep them under 5 minutes. We know caregivers don't have a whole lot of time, and we appreciate that. So we try to keep our videos short, and you can rewatch them as many times as need be. So then we've got the living room area. You can see we've divided that up with videos, the kitchen, the home stairway. Here's the bedroom, bathroom, and then general safety tips that we might have. This will always be evolving. So make sure you check back with that. Then you would click on the dashboard, go back, and then here's our caregiver series. The caregiver series, we have a lot of videos in our caregiver series. That was our original one. The thing I like most about the caregiver series is we've tried to divide all of our videos into green, yellow, or red, depending on the level of care or the level of assistance that person will need to help with that activity. So the min assist, the mod assist, and then the max assist. So green, yellow, and red. So if we go into the bedroom here, you can see, so this video would take low assistance, moderate assistance, and of course, with the more mechanical lifts and the sit to stand lift, it's going to be more of a max assist for that. Let's see, let me go back here. And another nice thing about this too, we also have some general tips here. We also have equipment. So if you just got a hospital bed delivered to your home, here's kind of the basics about a hospital bed and safety features, as well as the mechanical lift. I mean, that's something you need to learn about with the mechanical lift and the slings. Yeah.
So yeah, I was going to say about the hospital bed, and sometimes as healthcare workers, we don't understand this or don't realize this, but I went to a client's home one time, and he had a hospital bed, and I asked him if he's having any trouble getting in and out of the bed. And he said he couldn't get out of his hospital bed because the bed rail was too, he couldn't get over the bed rail. And I, of course, asked him, have you put it down? And he said, yes. And he said, but I can't get over it. And I said, well, you can take that bed rail off. And he said, oh no, it's welded on there. And so I went in and we went through it, and I showed him how the bed rail could come off of the bed because he actually didn't really need it. And you would have thought that I was the next best thing since sliced bread. I mean, he was the happiest guy. And it was that simple thing. But as a healthcare worker, these are things that are pretty typical and common to us. But we have to remember, the caregivers and the clients may not know these things. So this is a good resource to find some of those things out.
Right. And so we also have some general helpful tips that we've kind of learned along the way from other healthcare workers. And then we also have three leg strengthening levels. So we've got the one in supine or in bed, depending on your loved one or your client's skill level. We've got the leg strengthening exercise in sitting, and then also in standing. We talk about the stairway, and then we have some transfers, how to do, a pivot transfer. And you can see, so this transfer would be a little bit easier. This one's moderate, and this one is max assist. So going back out to the dashboard, is there anything else? Let me show you this real quick too, resources. So we have, again, the assistance levels listed off if you want to find out a little bit more about what the green, yellow, and red looks like. And then we, sometimes in therapy or in healthcare in general, you can't get around talking about using certain buzzwords and stuff. And so we tried to take that into consideration, and we've created a subscription glossary, and this is always going to be changing. But basically, it just talks about things that we might have mentioned in our videos that maybe just need a little bit more definition and that we just could not get around using. So take a look at that too when you get a chance. So what we're going to do now, so for access to this, make sure you reach out to Chris with AgeSmart and to get an access code, so you'll have access to these. So if you don't have access to it, Cindy and I, with Adaptive Equipment and Caregiving Corner, even if you do nothing more with this information, we encourage you to at least go to our website. We have a lot of free information. We give away a lot of free information, a lot of really great resources. And consider, telling your clients or your loved one to come here, because we have a really quick version. So the quick home safety toolkit, it's a quick version of it that's listed on here. So if you go to our website, aecorner.com, you come to the free videos, you'll come down here to sponsored videos. And then here's the home safety quick start program. You click on that and it will drop you off on we have 4 videos on here. So here's what we were just talking about. The tips for chair height video, the tips for bed height video, the tips for toilet height video, how to install a raised toilet seat. And then there's a 5th one. Okay, I miscounted, there's 5. And then the last one is how to apply a gag belt, which is a really, really good one too. So you guys will have free access to this, and we encourage you to at least tell people when you're leaving, if it's not a planned stay, and before you bring your loved one home, come check out these videos, help them have a successful transition back home by looking at these videos, and help their transition back home be more successful and make them happy. So, so back to the website here. In addition to that, under the free videos, we also, Cindy and I, when we first started Adaptive Equipment and Caregiving Corner, we started out as a YouTube channel. If you're wanting to have a Throwback Thursday party, go check out some of our initial YouTube videos from back in 2015 when we started with just my iPhone, and we didn't even have a microphone. So those are kind of entertaining. So anyway, but what we've done is we brought those YouTube videos over onto our platform here. And so if you click on here, it will take you to all of our YouTube videos that we have. We have a little over 100 videos. And as we add them, they automatically get pulled over here. And so you'll find one thing I like about our YouTube channel now is we get a lot of companies that will send us their products. And so we kind of end up doing product reviews on a lot of some really cool, helpful pieces of adaptive equipment. And so we try to raise people's awareness of, did you know that being a caregiver is hard? Let us help you make it easier and safer. And so these videos will highlight those featured products. And so make sure you check back here to see, what kind of product review video. We try to get one done, at least 1 or 2 done a month. So make sure you check back there. In our other videos that we have that are free, we have other sponsored videos. St. Anthony's in Effingham, they use our videos for helping their knee and hip surgery patients. So lots of times when you go get your joint replacement, Lisa Phillipson, you can attest to this, you have to sit through at least one class to know what to expect before you go into surgery. So St. Anthony's has graciously sponsored our hip and knee surgery series. And you can go there and click on that to find out what to expect for their surgery, the hip and knee surgery. And then you might recognize this. This is Hospice of Southern Illinois. Speaking of Lisa Phillipson, she came to our house and we did a knee replacement. So we did an interview with her, and she talks about her success of having both of her knees replaced. So if you get a chance to stop by here, stop by there. And
we need to make sure we did a knee replacement video. We didn't replace her knees.
We did not replace her knees. Lisa does not want us touching her knees with a scalpel. So, then the next thing that we have is featured products. So as Cindy had mentioned before, we, in our videos, we highlight products that we've actually used, and we have additional access to those products here. So if you go and click on the bathroom tab, you can come here and you can go to Amazon. This will drop you off at an Amazon page, and you can get all of the, well, it's got it all listed here, all the specs and stuff listed here. So look at the specs before you order it, make sure that it's going to fit into your house, and that way you won't have to return it. So there's all of our featured products here. We have more resources. We have national resources. We try to, if you know of a helpful resource, please reach out to us. We've got them listed by state here. So you could see we got St. John's Community Care, and then in St. Louis we have the St. Louis Help listed here. If you know of one, stop by here, leave us a message, let us know of something. We would love to list that on our resources page. We also have helpful hacks. And that's just kind of started, because we're on lots of social media platforms, we get people that reach out to us and say, hey, did you know that this is a thing? And most of the time we say, no, we didn't. So we always try to raise people's awareness of pieces of equipment or technology that we think would be helpful. So we've had some people reach out to us with this and with this. And this we just started not too long ago. So if you have a piece of equipment that you think would make an awesome, helpful hack for people, again, drop us a line and let us know. We would be happy to put it here on this page. And then we also have our Edocs and Archives page. And with our Edocs, what this is these are the 3 documents that we talked about, our interactive documents. So even if you don't have access to any of the videos, then you can come here and you can download. Here's the home safety checklist. Here's the home safety equipment index. And then here's the quick start guide. So when somebody is getting discharged from a hospital, from an unplanned hospital, come here, you can download the home safety quick start guide and check those top 3 areas of concern. Scrolling on down, this is our YouTube video catalog. We got some QR codes. We love QR codes here at Adaptive Equipment and Caregiving Corner. Here's a whole catalog of all of our YouTube videos with the QR code. And then we also do a newsletter too. We've been doing it since April. This is our year anniversary for putting out a newsletter. But here's the archive where you can go through and check out all of the helpful information that we put out in our newsletter. And then here, if you want to contact us, click on here and you can leave us. Yeah, please reach out to us. We want to get that information out to all of our clients and our viewers and stuff.
And we do take a lot of, on social media, we do get questions. We love that type of thing. We may not always know the answer, but we do have some good resources. We have a lot of therapists and we try to figure things out for people the best that we can. Just a quick we had a guy contact us a few weeks ago. He had his dad likes the little fruit cups, but it was unable to get the top peeled off and was making a mess and wasn't able to get it off there. So we actually tried to think about that and tried to think about a quick way to help him do that. So we came up with using a real thick marker and a piece of Scotch tape. And then we were able to just roll the top of that off. We actually have a video on that. So anything like that, we enjoy it. I enjoy thinking about those types of things and working with other therapists on trying to think about that. And a lot of times, the piece of equipment is probably out there. There's just so much out there that sometimes it's hard to find. So we try to do research on that and find some things out for people. So feel free to contact us with questions or things that are helpful to you. And we will share because that's what our site is about.
And we're big therapy nerds.
Yes.
So nerds. So here's the rest of it. So going on down, we've tried to feature a YouTube video that we think might be helpful. We've got here's another featured product. There's our current newsletter. We try to feature a business. Here's where you would scroll down to get a subscription if you were interested in subscribing to our video. We've got a 2-day plan, a monthly plan, and a 1-year plan. There's the home safety, the Quick Start program. This tells you a little bit about it. Here's something that Cindy designed, a piece of equipment that Cindy designed was the ProFlex 2-in-1 And then we've got our trusted resources. So we just have a whole lot of information on our website. We'd love for you guys to stop by and take a look at it. Drop us a line, let us know, and talk to us. If you got questions, we'd love to help answer them.
Absolutely.
So that's all I have. So if anybody has some questions, we'll go ahead and open up the floor for questions.
Mm-hmm.
Hang on, I'm trying to get my video started again. There we go. Here I am. The first question I'm going to take, Summer, you asked about the only way to access this is going through HSmart to get access code. What you need to do is you need to go to the Adaptive Equipment Corner website, and I'm going to give you all the code right now. And I will tap it into chat also, but the code you want to use, the access code, is AgeSmart Cares. That's it.
Yep.
You just type that in. You're not going through HSmart's website. You're just going through Adaptive Equipment Corner's website. HSmart isn't getting any of the information. I think the only question I've ever asked Christina and Cindy is, hey, how many people have used the code? and that's all we've ever done. So you're not really, you're still going through Adaptive Equipment Corners for that.
Yes, you'll come here to share. You'll come here to our website. You'll click on the registration button the very first time when you get that code. Well, it's because I've already been signed in, isn't it? Yeah. So you'll come here, it'll drop you off to the registration page. The registration page looks like this. Put in your name, your email address, your address, you create a password, and this is where you'll put under code with a little question mark right here, you'll put in AgeSmart Cares. And then you'll see that it changes, that's access code. You'll have 190 days access. Click the disclaimer box, click the sign up box, and it will take you, and then you have created a dashboard, and then it'll drop you off right to where we were demonstrating it. Okay.
Okay, that was question number one. Moving on to, we've only got one other question right now. Asking about discussion of adaptive equipment for people with arthritis, especially in the hands.
Oh,
Nice.
love it. Hang on just a second. Do I have a functional hand over there?
Oh, yeah.
Hang on just a second. Let me get
So we get people that reach out to us, products like we were talking about. We had this company reach out to us. They were actually a PT and an OT, and they've created this device. It's called the Functional Hand, and we've done a product review video on it. So if you get a chance to take a look at that, but we also have the device, and Cindy just went to grab it and stuff. But it really helps. It's just like a handle.
Yeah.
There you go.
So what it is this, and it's a built-up handle, and it's got this cord right here that you can actually load with a utensil, a pin, something like that, and then you lock it down right down here, and then it gives you a bigger grip. So with arthritis, you need a bigger grip for your hand. So this is basically what that is. So you can pretty much load anything that will fit inside this stringer. You can pretty much load and then have a bigger grip to use either horizontally or in a vertical position. But we did, like Christina said, we did review that on our website. So if you go to the website under our YouTube videos, look up Functional Hand, that is what this is. I would also recommend, there is also a video this is going to be a throwback because it was one of our early ones. It's called Easyhold. And will you put that in there also? Easyhold was developed by two sisters, one of them that had rheumatoid arthritis. And it is basically, I don't have one.
No, it's a silicone. It's a silicone strap. We call it a universal cuff, but it's a silicone strap, so it makes it nice for to wash if it gets dirty and stuff. But you could put, it's got two round ends to it, and then so you could put it on an electric toothbrush or a toothbrush or a pen. I mean, if you could put two ends on it, and then stick your hand through it. So then if you have weak grip strength, then you just slide your hand through it, and it really helps. Like Cindy said, one of the sisters has rheumatoid arthritis, and so you know, she developed it for that particular reason.
Right.
She uses it. She'll put it. She has horses, and she'll put it on a horse brush, and all she has to do is slide her hand in through the silicone strap, and then she can brush the horse and stuff. So yeah, lots of stuff like that. And then with the opening up the fruit cup and stuff, that was because a gentleman's father had rheumatoid arthritis, really liked those fruit cups, but couldn't peel that hard plastic off of there without making a mess. So check that video out too. Sometimes necessity is the mother of invention, and
That's right.
you get a lot of really cool things out of that too.
And with those, just a reminder, with those videos, drop down into the comment section, and that's where we put the links to go find those products.
Yeah.
So.
And just to remind us that this information isn't just for older adults.
Oh, no.
One of our attendees said, thank you very much for the tip on the fruit cup. This will be great for my teenager who has dyspraxia and can't manage those film cups. So these are things that can be used across the age spectrum.
Yeah.
That's exactly
And actually, yeah, this functional hand, actually, the two therapists are pediatric therapists.
Yeah.
That's who they developed it for. They just came to us because they knew we were in the geriatric population, and they want to make sure that our geriatric population knows as well. But yeah, this was developed for the peds.
Yeah.
So.
Okay. Another question: is there a point where a home is not safe to move back to? And I think all three of us will agree on that. Yes, there is. My mom and dad are moving into assisted living because their 50-year-old home just doesn't seem like it can be made accessible without great cost because it is in serious disrepair, foundation issues, running walls and bathroom, etc. Do PTs ever do walkthroughs of a place to give advice?
Oh yeah, yes. PTs, OTs, they do that. Yeah, absolutely.
Yeah. And that's another time. Take that checklist. I mean, even in an assisted living, I mean, because they are built for people, you know, with disabilities, but still walk through it, because sometimes as the building ages, it's, you know, it isn't up to code, or things that have come out since it's been built that would actually help. So download the checklist and do a walk through the apartment, or a walk through, you know, the common areas or whatever, and how can you adapt that environment for your loved one.
Right. One other thing that I want to bring up too is there are therapists out there that will do the home assessments for private pay, but I want to raise people's awareness that it used to be, and it's not always now, but I would, if you can try to insist, but if you have somebody transferring from skilled nursing to home, we would always go out and check the home out before we sent that person home. Now that's not done as much as it used to be, but that's something that I would certainly request, because if they're under therapy care, I would certainly request it, because then in that realm, you may be able to get it paid for by their insurance. So just FYI on that.
Okay. Next question. What is the best can opener for the arthritic hand?
Oh, that's a good one.
There are a lot of can openers out there. I would probably do, since there's so many, we haven't done a specific product review on that, but I would take a look. I can take a look. Usually what we're looking for the arthritic hand is something that's going to have a big lever arm. So an oversized, well, first of all, I would say try to go for an electric one. But if you can't do that, an oversized lever is what we're looking for, oversized hand grips. And I can pretty much tell you, I believe, if you would Google can opener for arthritis, you're going to find all types of options, because there's a lot of focus on that type of equipment right now, especially in the kitchen. But if you want to drop us a line, I don't care to do some research on that. I'm not sure who's asking that question, but if you want to drop us a line, we'll certainly take a look at it.
Yeah.
That question, it was an anonymous question. So
okay.
I can't tell you who asked it.
That's fine. Feel free to, if you want us to do some research, we will certainly do that. Contact us on our website, on the contact page. We'll do that for you if you'd like.
Reach out to us on, we're on Facebook also, Instagram, LinkedIn, Twitter.
Okay, I'm gonna have one last call for questions. If anybody has any questions, give you a minute to open that up. I do have to say, I misread one of your posts. I think it came in this morning about the pelvic exercises.
Yeah.
It said and I thought it said and beer, and I'm like, what? Oh no, that was a name, Bria. Okay, got it.
Yeah, that's the OT that's doing that she does yoga. She's actually, she consults with us. She's the OT that consults with us too and does our OT work, Becca.
Mhm.
Okay, well, it doesn't look like anybody's typing or anything, so I think that's it for our questions today. Lisa, you want to take us out?
Sure, I'll take us out. Well, first of all, Christina and Cindy, you can tell by all the comments, there's so many people that need this information. So, and I always say this, we're all one car accident away from needing all this information, you know?
That's right.
So I want to thank you for your time. We all thank you for your time. We thank all of you that attended for your time. We hope you can join us next week. And next week's presentation will be from Memory Care Home Solutions, Amy Sabrino, who's a very talented speaker. She's speaking on practical strategies family caregivers can use in and out of the home. So we hope to see you next Saturday. Christina and Cindy, again, we can't thank you. You're making a difference for all these folks. So Chris Bolton, thank you for a job well done. Everyone have a wonderful weekend. Thank you, everyone. See you next week.
All right.
Bye.
Bye-bye.